Welcome to our post-operative instructions video. Today we'll guide you through the essential steps to ensure a smooth recovery following your surgery. Please pay close attention as these instructions are crucial for your comfort and well-being. First, let's discuss managing discomfort. The local anesthetic will wear off within 1 to 4 hours after your surgery. To stay ahead of any discomfort, take your prescribed pain medication before you start feeling pain. If you've been prescribed ibuprofen, take it every 6 hours if needed. You can also take extra strength Tylenol every 6 hours, but stagger it with your ibuprofen. So you take a pain medication every 3 hours. If your pain isn't controlled with these medications, please contact our office. Next, let's address swelling and bruising. Swelling often peaks around day 3, and bruising may occur, especially around the eyes. To reduce this, use ice packs on the outside of your face for 10 minutes at a time, 4 to 5 times a day, but don't apply ice for more than 10 minutes to avoid frostbite. If swelling increases after day 4, or if you notice any concerning signs like a bad odor, taste, or pus, contact our office immediately, as it could indicate infection. Now, let's talk about bleeding. Avoid rinsing vigorously in the first few hours to allow the coagulation process to proceed. Some slight bleeding may persist for up to 48 hours. This is normal. If you notice crimson-colored blood clots near the surgical site, you can gently wipe them away with gauze or let them wash out on their own. If excessive bleeding occurs, use a moist piece of 2x2 gauze or gauze soaked in black tea solution to apply constant, firm pressure over the bleeding area for 10 minutes. Remember not to disturb a gum graft area. If you remain concerned about bleeding, don't hesitate to call our office. Moving on to oral hygiene. In the first week, avoid brushing the surgical sites, but keep the rest of your mouth clean. If you were given a mouth rinse, use it twice a day for the first week, then stop. You can also use a salt water rinse, half teaspoon of salt in 1 cup of warm water 3 to 4 times a day to reduce soreness. In week 2, you may gently brush the surgical site with a soft toothbrush, but avoid brushing the gums. You can resume flossing without strong pressure on the gum area. After 4 weeks, you can use an electric toothbrush, but avoid using it on a metal healing cap placed on a dental implant. Regarding nutrition, for the first week, avoid hard, chewy, or spicy foods, as well as foods with small seeds. Acidic foods like orange and grapefruit juice may sting. Stick to cold, soft foods like ice cream, jello, pudding, yogurt, and milkshakes for the first 36 hours. Avoid hot foods, but after 36 hours, warmer temperature foods are fine. Refrain from using straws, vigorous rinsing, spitting forcefully, and avoid concentrated alcoholic beverages and smoking for the first few days. Rest is essential for your recovery. Avoid strenuous activity for 72 hours following your surgery. Give your body the time it needs to heal. Finally, regarding sutures, some may be dissolvable and may come out a few days after surgery. Don't be alarmed. If they bother you, you can carefully trim them or let them dissolve and fall out on their own. That concludes our post-operative instructions video. Remember to follow these guidelines carefully for a smoother recovery process. If you have any concerns or questions, please don't hesitate to contact our office. Thank you for choosing us for your care, and we wish you a speedy recovery.